quarantine, and you got to pay for it your own self. 828. Let's bring on John Quinata here, the acting GM of the airport. Good morning, John. Thanks for joining us.
Good morning, Chris, and good morning, Sabrina, and of course, good morning, Guam. We need to keep you safe.
Right. So let's talk about this. We care about your safety, the We Care campaign that you guys have launched.
Well, basically, we continue since July. We are prepping the airport for arrivals of passengers and stuff. So, what we've done at the airport, we've got, of course, we've changed our entry control points to just one in the departure area and one in the lower level in the arrivals area. So, people when they come in, passengers or folks that are working, employees, or people that are doing business at the airport. Those are the only ones that can come in. And so they will go through a thermal screening process. As they go through a thermal screening process and they pass, of course, they'll go in and enter the airport. What we've done in the airport, of course, is we've got our transparent, our plexiglass barriers, sneeze guards that are in place. We also have our improved our UV filters around the airport, where that the aircon system, when it circulates, it goes through and it goes through a filtering system, so it captures that. Hand sanitizing dispensers are all over. Touchless restroom features. Your cloth or your paper towels when they come out and stuff, it's all touchless. We require face masks to come in. If you don't have a face mask and you're coming in, you're going to be a passenger, we will provide one for you, courtesy of FAA. FAA has given us face masks for anyone that's entering that is a passenger and they don't have, or maybe they have a face mask and it broke. We will be able to give them a face mask.
JQ, are people still trying to go into the airport without a face mask? That's crazy.
You'd be surprised, Chris, but yes.
Wow.
Folks trying to go in and they'll take their shirt and they'll cover their mouth and their nose, but we will provide them. If they don't have any, we have the ability to provide them a face mask.
That's good.
And so of course we're always trying to encourage social distancing. There's times when families are together and stuff, but when we see other family members and they're all congregating, we ask them and we request them to keep their social distancing. And then, of course, while in the airport and on a frequent basis, our contractors, our cleaners, consistently sanitize the areas where folks are in. That's the deep cleaning and also the fogging of disinfecting of areas wherever the public is at.
Where are you, JQ, with your employees and the confirmed cases that were announced? Was it a couple of weeks ago? Is everybody cleared and back to work?
Out of all the folks that were cleared, Sabrina, we have only one employee left that's still waiting their 14-day process. So that we only have one left that's not cleared to come back to work.
Were you guys able to track how they contracted? Was it from outside contact?
In all my employees, and I'm knocking on wood, in all my employees that contracted the COVID or were positive for COVID, based on our in-house contacting tracing team that did the contact tracing, yes, they were all outside of the work area. It wasn't as a result of passengers coming in or folks that were in and got other folks infected. It was based on their exposure at home or within their family congregating together.
I'm just looking at the release that you guys sent out about the We Care program, and it talks about this designation of a safe travel facility.
Yes. So based on all the things that we've done to keep our airport safe. Guam International Airport was designated as a safe area travel facility to arrive and depart from.
And do you have any sort of updates on discussions on rapid testing when travelers arrive to the airport?
So the Physicians Advisory Group has worked with us on different courses of action, and based on what what requirements they're asking us, we have given them information. But basically, the airport, our role is to provide the facility and provide the room that they need, the size of room, the requirements they need. As of this day, we have not received what direction we're going to go, whether we're going to be having testing at the airport, what kind of testing that we're going to do. But we are, like I said, we are ready to, we're prepared to execute in what they have decided. I guess the Physicians Advisory Group would get with the governor and, of course, public health. Ultimately, in the end, public health needs to approve whatever testing is done at the airport for arriving passengers.
Mm-hmm. What about discussions with like GVP, GHRA? Because I know all of them have been talking about, some sort of a strategy to reopen Guam. And I want to say that testing, rapid testing, mass testing has always been something that's been brought up. And so having said that, have you been involved with any of those discussions?
We have definitely been involved. GVB, GITA, the Airport Authority, the Council Generals have been involved, because we're trying to find, think out of the box kind of thing, of ways to entice passengers and visitors to come to the island. We try to look at Hawaii, at what they're doing. And what is it that is attracting them? Unfortunately, Hawaii is only accepting folks that are testing in the United States coming into Hawaii, and our process right now is everyone's going through 100% quarantine at this time. So, but we're trying to find ways to entice passengers to come in and get possibly the folks that are coming in from low risk areas. Maybe they have COVID, but they're not as high as the U.S. or other areas of the world. But for example, Taiwan, their test positivity rate is very low. So we're trying to entice those folks from coming in. Probably create a travel bubble type where these folks that come in from, let's say, Taiwan, and they're saying, okay, in this group, we want to go golf, we want to go shop, and we're gonna want to eat at this area. So when they come in, that we sterilize all those folks and they keep them in a bubble as we move them on, and limit the exposure to the local population. Mm-hmm. and stuff. So for example, a plane will come in, they'll go and golf in the morning. In the afternoon, they'll take them to probably a eating facility or maybe a caterer that will cater their food outside, and then possibly take them to either shopping in a area that can be closed off, or possibly they can shop online and then they'll deliver their stuff to them while they're at the airport, and then leave the next day or in a couple of days. We want them to try and come in, and there is people that want to do that. According to the Council General, there's folks that want to try that experience, to come in and do those kind of things. Mm-hmm. And it's not just golf. Some people want to go to the go to the beach, and do that kind of stuff. But yes, we're trying. The GVB, us, the airport, and of course even United Airlines. They're the airline partners. We're trying to find every single way to try and entice folks to come into the island.
Well, speaking of enticing people to come in to the island, we actually have
Hey, look at that. What do you know?